Welcome to the course Internal Family System Therapy. In this course, I want to talk about the Internal Family System Therapy or IFS therapy approach. Internal Family System is an evidence-based approach. It uses family systems theory, the idea that individuals cannot be fully understood in isolation from the family unit. IFS aims to develop techniques and strategies to effectively address issues within a person's internal parts. By learning how different parts function as a system and how the overall system reacts to other systems and other people, people can become able to identify the roots of conflict and achieve greater well-being. IFS was developed in the early 1990s by Richard Schwartz. Schwartz had received training in systems thinking and family therapy theory. He developed the approach after listening to people in therapy speak about inner parts within themselves. The IFS model has 5 basic assumptions. First, the human mind is subdivided into an unknown numbers of parts. Second, each person has a self, and the self should be the chief agent in coordinating the inner family. Third, parts engaging in non-extreme behaviors are beneficial to the individual. There is no such thing as a bad part. Personal growth and development leads to the development of the internal family. And the 5th assumption is that adjustments made to the internal system will result in changes to the external system and vice versa. There are 3 distinct types of parts in the IFS model. First, managers. Managers are responsible for maintaining a functioning level of consciousness in daily life by warding off any unwanted interactions, emotions, or experiences resulting from external stimuli. Exiles. Exiles are most often in a state of pain or trauma, which may result from childhood experiences. Managers and firefighters exile these parts and prevent them from reaching the conscious level so that proper functioning and preservation are maintained. Firefighters. Firefighters serve as a distraction to the mind when exile break free from suppression. In order to protect the consciousness from feeling the pain of the exile, firefighters prompt a person to act on impulse and engage in behaviors that are indulgent, addictive, and oftentimes abusive. Firefighters may redirect attention to other areas such as sex, work, food, alcohol, or drugs. Managers and firefighters play the role of protectors, while exiles are parts that are protected. In IFS therapy, the self represents the seat of consciousness and what each person is at the core. The self demonstrates many positive qualities such as acceptance, confidence, calmness, wisdom, connectedness, leadership, and perspective. It's the witnessing eye in the inner world which observes. The IFS model aims to differentiate the self from the other parts. The goal of IFS is to unburden or restore extreme and wounded parts and establish a trusted, healthy, harmonious internal system that is coordinated by the self. IFS therapists try to help people achieve and maintain a state of self so they can become counselors to own internal families. This increased internal harmony often results in positive thoughts and behaviors in the external life of the individual. Issues treated with IFS: trauma, physical, emotional, or sexual abuse, compulsive behaviors, depression, bipolar, body image issues, anxiety, phobias, and substance dependency. A session of IFS therapy may take the form of traditional talk therapy. A therapist may also choose to focus on an affected individual's internal environment and help the individual connect different parts to self. For example, a person who is experiencing alcohol addiction may be asked to relax, take a few deep breaths, and try to feel the part inside that wants to keep drinking. The person in treatment focusing on the internal environment. The therapist asks how the person feels about that part. The individual may report feelings. The therapist will explain the need to find out the reason behind the part's action. The part explains it acts in the way it does to help the individual deal with difficult problems being experienced. Therapists instruct the individual in treatment to ask the part if it would be willing to stop its actions if other effective coping mechanisms were used instead. The part may strongly doubt any other methods will be able to help the individual to cope, yet still be willing to try these methods as there is nothing to lose. With permission granted, the therapist will often then help the individual to deal with issues in healthy and constructive ways. Techniques and exercises: keeping a journal, using diagrams to illustrate relationship between parts, the room technique. In this exercise, one part watches as the self interacts with another part. Mountain or path exercise. People in therapy visualize themselves walking along an inviting path. If one can see oneself in the image, the therapist will encourage the person to move into the body and view the scenery from within, asking the individual to pay careful attention to the thoughts, feelings, and sensations that arise. This exercise is believed to help a person in therapy explore and better understand the inner world. Getting to know whoever's there. An individual is encouraged to breathe, relax, focus on the inner world, and get to know the present parts even better. Feeling one's heart. An individual is encouraged to breathe, relax, and feel the heart. The individual may ask the protectors to step back for a while so the exiles may be better understood.